Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, we talk about menopause, biologically inevitable and, for a long time, a taboo topic. Today, Stephanie Desmond talks to Dr. Martha Hickey, an expert who works in Melbourne, Australia, about the need to stop talking about menopause as a medical disorder and instead think more broadly about how to educate women about what to expect and to reduce the dual stigmas of gender bias and ageism. Let's listen. Martha Hickey, thanks so much for joining me.
Thank you.
I want to start with an easy question, but maybe it's not so easy. What is menopause and why don't we talk about it more?
The menopause is the final period that a woman ever has. So it's kind of a difficult thing to know because for those who've had a hysterectomy, for example, or using hormonal contraception or don't have regular periods anyway, or there's so many reasons why somebody may not know when their menopause actually happens. So we tend not to use that term and talk about the menopause transition to try and encompass the time of changes that people notice.
So why is it something we don't hear a lot about?
Like a lot of things to do with women's reproduction, menopause has been associated with shame and with stigma. Something we try and really go to in Lancet papers is this combination of ageism, which we know is highly prevalent across most countries in the world, and also sexism, which is also highly prevalent. So for a woman experiencing menopause, she's hitting that double whammy of ageism and sexism, what's sometimes called gendered ageism. And menopause represents the fact that you are no longer a young woman.
You argue it's time to stop treating women like patients who are suffering from a disorder. I mean, it's biologically inevitable that this will happen, but there's more to it.
Yeah, look, it would seem very strange if all the women in the world developed the same disease at about the same age. I mean, that just doesn't make sense. I think the idea of this being a disease is dead in the water. But we really need to recognize that for some people, this is a tricky time. They may experience symptoms as other stuff going on. I increasingly feel there's a last straw element to menopause. You keep everything up in the air with your older parents and your job and your kids at home. And then your sleep gets disturbed. Then you start having flushes. And that's really what pushes you over the edge, so to speak, the edge being that you feel that you need to take something. But not all of those things that are happening to you are due to hormones. It's a combination of life and hormones as well.
So does every woman of a certain age develop symptoms?
Not everybody, but about 80% of women get hot flushes and night sweats. But the variation between women and within the same woman over time is really very, very marked. And we actually have no idea why that is. And it's an important research gap because at present, for younger women who may be, coming up to menopause, we don't know what to tell them about what's going to happen for them personally.
I feel like, I recently asked my mother, as someone who's coming up to the age perhaps of menopause, I recently asked my mother when she began menopause and she gave me a really outlandish figure. And so I thought, if she can't even remember and she can't help guide me through this, like, where do I start?
Yeah, so that's something else that we are very focused on in the Lancet series is the lack of high quality information. It's called knowledge is power, of course. We just looked through some in the US and in the UK, also in Australia, websites that you would expect would be high quality and providing evidence-based information. And they were all different. They were telling you different things about symptoms, different things about whether to take hormonal treatments. It's not surprising that people are confused given this variation. And to some extent, it does reflect the variation that happens between people. But we would like to see women approaching menopause being equipped with high quality information about what to expect and where to go if they want help.
I would say that it's been a sort of taboo conversation for a long time. When has that shift began?
There's been a lot of advocacy in the UK, particularly for celebrities talking about their experience of menopause. And that's great. It's great to have had that taboo lifted to some extent and great to have people speaking. But we lack diversity in what we're hearing. So far, all we've heard are horror stories. And whilst that is the case for a small percentage of women, it's really not everybody's experience. So I think bringing some more diversity into the conversation is important. But it's quite difficult for somebody to say, oh, mine was all right, because it appears to be somewhat dismissive of other people's, severe experience.
So how should we talk about menopause differently? When should we start talking about it? And what kind of language should we be using?
I think these are great questions. We should be talking about menopause from school, from childhood education, because it's a normal biological process. And I think other biological processes are covered, and this one affects more than pregnancy. So it certainly should merit getting a mention. When it comes to how we talk about it for women who are experiencing the menopause transition, I think openness is really important for two reasons. One is that it's clear from the research that if you are stressed about the fact that you may have a hot flush, say, for example, you're in a work environment that is, not accepting, not diverse in that respect, your symptoms are worse. So you're actually fueling this negative cycle of severe symptoms that might then drive that woman off to have to take medication. And functioning at work is one of the main reasons that women take menopausal hormone therapy. And the other issue is that we've learned from COVID, or we should have learned, that some people's work is essential. Nurses, for example, health workers generally, educators, people who work in food industry, they're nearly all women. And the average age is about 45 for a nurse. It's going to happen to everybody. If we don't look after our workforce, then we potentially going to lose people, and we really can't afford that.
So I understand that there are some mental health symptoms for menopause for some people, and for some people it improves things. Some people it makes things worse.
Yeah, we really were interested in doing the menopause and mental health paper because we all expected to find that menopause caused mental health problems, because that was the prevalent belief. And we didn't find that. We found that most women experienced menopause without any mental health problems, but that there were a minority of women who were at risk, and that was to do with hormone and also to do with situational factors. So we're really excited about that because it means that you can identify who might need additional support as they transition through menopause. And I'm talking about, clinically significant depressive symptoms or clinical depression, so the more severe end of mental health problems. Because I don't know whether this has been a thing in the US, but in the UK, there's been talk about suicide being increased. So we also drilled down into the evidence around serious mental illnesses like psychoses and also suicidal ideation and completed suicide. And we did not find any evidence for those things. So I think this is a good message for women. And in the setting of menopause, good messages for women are really important because all the messages have been bad, basically. You're not only getting old, but you're going to have these hideous symptoms. You won't be able to do anything. So the good message is your mental health will usually be intact. And if not, there's things that can be done to support you.
So how do you know when it's aging to blame and when it's menopause?
You don't really. The only way you could know that would be to look at women who experience premature ovarian insufficiency, so menopause below 40 or early menopause before 45, and say, do they get the things that we think that menopause might cause? And not great data there. So I think that's an important question. What does menopause cause? But because menopause is unavoidable, maybe it's not such a useful question. Can you prevent those things by taking menopausal hormone therapy? Well, no, you can't, as it turns out. What you can do, and I think this is important to kind of pull back to the evidence, exercise, diet, not smoking, drinking in moderation, the kind of things that are protective of our health as we get into older age are the same, actually. Taking hormones does not seem to confer the kind of health benefits that people once thought.
So where are we with hormones? I know they were in favor and out of favor. Where are they now?
It depends on where you are. Some places, so the UK has increased by about 60% use of hormones in the last couple of years. The US, I think, has also increased, but it's very patchy because this is primarily a wealthy white woman's medication. I mean, I think we need to remember that. And the great dilemma around socioeconomic background and MHT is, do other women, less advantaged women, women from different racial and ethnic groups, do they not take it because they don't want it or because they can't get it? And that is a source of considerable discussion.
Mm-hmm. What happens in lower and middle income countries? What's the conversation about menopause look like?
We're, again, very different. And we were really interested in that and looked in our own country, first of all, at First Nation Australian women who rarely have symptoms, certainly rarely seek treatment, but tell us that in that culture, they grow in status and value into the community as they get older. And we've noticed the same thing looking at cross-cultural studies across many Asian countries. So it does seem that when women are valued for their contribution as they get older, rather than being seen as somebody who can't do what they should be doing, which is having babies, then that has knock-on beneficial effects for what we experience as menopause. The biology is ubiquitous, but the experience is hugely different.
It seems like an area ripe for behavior change at this point.
Yeah, I think so. And cognitive behavior therapy has, of course, done a lot in this field and works really well to reduce the impact of hot flushes. But it's more, I think, what we're looking at is more community behavior change. That since women over 50 are the largest growing sector of the population and one of the largest growing sectors of the workforce, and more than 3/4 of the unpaid workforce in terms of carers, and they're all going to experience this, we really need to value those women more than we currently do as part of the workforce and as keeping the sort of social glue of caring across generations also. One thing that has bothered me for a long time is that we never see older women in public life or rarely see them in public life. We certainly don't see what they look like in terms of how their bodies look. So I don't know if you saw the art section that accompanied this series. The first time the Lancet's ever had an art section, as it turns out. And these photographs, we're trying to say the same thing with the images as we're saying in the text. You know, these are strong, capable, beautiful women.
Can you describe the art for someone who hasn't seen it?
So the art was part of a wider exhibition called Flesh After 50, which we ran in 2021, really along the lines of older women's bodies. What do people make of them? How could they be shown? And one piece was 500 strong, which was 500 black and white photographs of naked older women. And some of those photographs were selected for this issue of the Lancet. It was quite funny, actually, because they wanted quite modest pictures, and they selected modest pictures of very slim, kind of good-looking women who could do things like stand on their heads. And the artist said, no, you can't do that. I want some big asses in those images, or you can't have them. So we had a bit of trading about what constituted a big ass, but there's more shape representation than there was at the beginning.
If you could tell women everywhere who are maybe, say, in their late 40s, what they should expect, what would one piece of advice be?
I think be calm. Women who've been through menopause have much more positive views about it than women who have yet to experience it. That's really important. The first bit is the roughest bit with the bleeding and the hot flushes. That's something we don't talk about enough. But when you actually experience menopause, your last period, you don't have any bleeding anymore. Pain goes, some premenstrual symptoms will go. So there are, like any major life transition, and women are, pretty experienced at major life transitions, there are pros and cons. And there's always help if you need it or want it.
Martha Hickey, thanks so much for joining me.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.